Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. It may interest you to know that natural products such as plants and herbs and their derivatives are the source of about 50% of all the pharmaceutical drugs that are used in modern medicine today. Now, one of those drugs is the popular and highly effective and inexpensive drug known as Metformin, which is used to treat type 2 diabetes. Now, metformin was originally discovered and extracted from the herb known as the Adëeva officinalis, or goat's rue, also known as the French lilac or the Italian fitch. Now, dating back to the year 1918, goat's rue extract, which contains metformin, was used to treat type 2 diabetes very, very effectively. The synthetic derivative used today is highly effective in not only reducing high blood sugar, high blood glucose, but it also lowers other cardiovascular risk factors like the hemoglobin A1C and insulin levels. And based on animal studies, metformin has also been shown to be beneficial on metabolic syndrome as well as non-alcoholic fatty liver disease and hyperlipidemia, which means high triglyceride levels. The drug is inexpensive, it has minimal side effects, and there's evidence of increased survival among patients taking this medication. In other words, diabetics who take metformin for their disease tend to have better health outcomes overall than diabetics who use other medications, as we'll talk about. Now, in recent years, metformin has also been there's also been evidence, very good evidence, to show that it has anti-cancer properties. In fact, it is proven to block key pathways that lead to cancer development, such as blocking what's known as the mTOR pathway. And it's been shown to kill cancer stem cells. We think that a lot of cancers arise from the stem cells within tissues, and it decreases the synthesis of very important cell receptors that are important in cancer cell signaling and growth proliferation. Like reducing the expression of HER2 receptors and insulin-like growth factor 1 receptors. These are important ways to prevent cancer. It also helps to block the formation of new blood vessels that would feed new tumors with oxygen and nutrients. This effect is known as anti-angiogenesis, and it's a key aspect of preventing cancers from metastasizing. As reported in the 2019 review paper, based on recent analysis and studies, metformin reduces proliferation of cancer cells and possibly malignancies in different types of cancer, including stomach cancer, pancreatic cancer, uterine cancer, medullary thyroid cancer, as well as prostate, colon, and breast cancer. These are three very common cancers, as you know. Studies show that since 2005, metformin has been reported to reduce the risk of cancer by up to 23% worldwide in individuals who are using it. For example, the results of the Taiwan National Health Insurance Data Survey, which included over 12,000 type 2 diabetics using metformin, compared to patients who had type 2 diabetes who were using other oral medications, following them from the years 2000 to 2007, those using metformin saw a reduction of cancer by up to 88%. And according to the results of Desensei in 2010, the likelihood of developing cancer in type 2 diabetic patients using metformin is 30% lower than that of patients taking other drugs for type 2 diabetes. And other studies have shown similar findings. Moreover, metformin has also been used to improve the efficacy of chemotherapy and radiation therapy for many types of cancer, including patients who have cancer who are being treated with chemotherapy or radiation. When they add metformin as an adjunctive measure, oftentimes the outcomes are better. This has been shown in some of the studies with breast cancer patients, pancreatic cancer, rectal and colorectal cancer patients, ovarian cancer patients, prostate cancer patients, patients with lymphoblastic leukemia, and non-small lung cancer patients, and a few other cancers as well. Details of the results of these findings were highlighted and really explained well in the 2019 review paper, if you're interested in that. In their concluding comments, the researchers stated that in addition to being an excellent drug to reduce blood sugar, blood glucose, as well as insulin and hemoglobin A1C, metformin can be considered as an ideal candidate for cancer prevention and improvement in the treatment of cancers. And as reported in the August 2021 review in the journal Frontiers of Endocrinology, these researchers stated, based on a systematic review of 53 studies, Campbell and fellow researchers concluded that independent of its therapeutic efficacy as an anti-diabetic drug, the use of metformin results in a reduction of all-cause mortality associated with diseases that accelerate aging, including cancer and cardiovascular disease. Now, given the fact that most people in our society see a rise in their blood sugar level as they get older, and they also often develop other risk factors for type 2 diabetes and cardiovascular disease, plus the fact that cancer is the second leading cause of death in the world, some doctors as well as other health and anti-aging experts suggest that beginning around age 40 or 45 to 50 years of age, almost all individuals might consider taking 500 milligrams of metformin daily as a preventive and anti-aging agent. Now, more research is required to test the true anti-cancer potential of metformin in non-diabetic individuals, but many doctors and health experts have begun using it themselves and recommending it to patients as a preventive and anti-aging intervention. Now, in my view, it should be kept in mind that natural agents like the EGCG, which is a very important compound found in green tea extract, as well as curcumin and soy isoflavones and indole-3 carbinol containing natural supplements as an example, they also show similar anti-cancer properties as metformin, and ECGC from green tea extract can also help to reduce high blood glucose. So these are important preventive agents as well, in my view, that deserve to be in any conversation about prevention and longevity. But I've included the references on metformin in the text below, so thanks for watching, and I will see you next time.